Nephrectomy is the removal of a kidney. This is done to treat kidney diseases, kidney injury, kidney failure, and kidney cancer. A nephrectomy can also be performed on a healthy donor. There are two types of kidney removal, radical and partial. Radical nephrectomy is the removal of the entire kidney along with the removal of other surrounding structures, including the ureter that connects the kidney to the bladder, the adrenal gland, and the fatty tissue surrounding the kidney. A partial nephrectomy is the removal of the diseased part of the kidney, leaving the healthy tissue intact. A person can effectively filter wastes and perform other healthy, regular kidney functions with a single kidney, so both living and deceased donations are possible. The most common reason a nephrectomy is performed is to remove a tumor from a kidney. The majority of these masses are cysts revealed from a CAT scan. When a patient presents with hematuria, flank pain, and a palpable mass associated with a renal mass, there is a 50% chance that the mass is renal cell cancer. Other masses among asymptomatic patients account for 5% of all renal masses. If you are a healthy individual, you may qualify to be a donor for someone whose kidney is not functional. Tests are performed prior to surgery to rule out any possible complications with the donor kidney. Blood typing is also performed to confirm compatibility between the donor and the recipient. Someone who has kidney cancer or a diseased kidney may be a candidate for a nephrectomy.
Hi, my name is Kelsey, and I'm going to be talking about the clinical manifestations of your nephrectomy. Clinical manifestations are pretty much the signs and symptoms. So signs and symptoms of kidney disease are often associated with other illnesses. So chronic kidney disease or acute kidney injury may not be detected right away. Also, your kidneys will compensate for one another, meaning that one will work harder if the other is malfunctioning. So your signs and symptoms may not appear until irreversible damage has occurred. So your signs and symptoms and clinical manifestations of acute or chronic kidney failure that could lead to a nephrectomy include decreased urine output, fluid retention, edema, shortness of breath, fatigue, weakness, loss of appetite, muscle cramps, and nausea vomiting. After you have a nephrectomy, you should not experience any different signs or symptoms than an individual with two functioning kidneys. It is, however, important to maintain function of your single kidney by a healthy diet, exercise, and routine functioning tests such as albuminuria, glomerular filtration rate, and routine blood pressure tests.
So you are getting a nephrectomy. We have previously discussed the specific bodily changes and risk factors that have occurred to require such a procedure, as well as discussing the different types of nephrectomies that can be performed. Let's now shift our focus to the different medications that may affect you during this procedure. Prior to the surgery, you're going to be required to stop taking many different types of medications as they may increase your risk for bleeding. You may or may not be taking all, none, or some of these medications. Vitamin E should be stopped 10 days prior to the surgery. Aspirin should be stopped 7 days prior to the surgery. Non-steroidal anti-inflammatories, or NSAIDs, should be stopped 48 hours prior to the surgery or as directed by your physician. A number of herbal supplements will also need to be stopped 1 week prior to the surgery for the risk of varied effects due to the surgical procedure, including an increased chance of bleeding. These herbal supplements include echinacea, garlic, ginkgo, ginseng, St. John's wort, and valerian root. So now that you have successfully stopped all required medications prior to the surgical procedure, let's discuss the different medications that may be used during the procedure, as well as some medications that may be provided to you post-surgery. During the procedure, you may be put under sedation. This will allow the surgeon to work on you without fear of causing you pain. Due to being put into an unconscious state, you will have no memory of the procedure itself. There are many medications used to provide surgical sedation, but let's focus on two: propofol and midazolam. Propofol is a short-acting medication with powerful effects that allow us to achieve sedation while also providing the patient with generalized anesthesia during the surgical procedure. It is delivered to the patient via an intravenous injection that has been measured out to the patient's weight in kilograms. Due to its powerful effect of sedation, the patient may be intubated to provide mechanical ventilation assistance should it be required during the surgery. Due to its strong onset of sedation as well as quick recovery, propofol is a common sedative used during many surgical procedures. Midazolam, though similar to propofol, has a longer onset of action time, but also lasts longer per dose than propofol. Midazolam also has a lesser ability than propofol to prevent the formation of new memories during total sedation. Both of these medications are popular in the surgical field not only due to their strong sedative properties, but also their ability to work in conjunction with opioid pain relievers. There are many opioid pain relievers on the market today that are commonly used in the surgical field. All of them work towards the same goal: reducing the perceived pain in the patient due to the actions performed during the surgical procedure. Let's quickly discuss two of these medications that you may receive during your procedure. Dilaudid and morphine are both opioid pain relievers that are used to inhibit the sensation of severe pain. They will be given intravenously during as well as after the procedure to maintain a tolerable level of pain control. On average, patients may expect the analgesic effects of these drugs to last approximately 4 hours. These drugs do need to be used cautiously by all patients as they both have a high risk of dependency as well as addiction. Both the opioid pain analgesics as well as the surgical sedatives need to be used with close attention paid to the dosing amount due to the low threshold for potential and accidental overdoses. All of these drugs have their own major side effects, but all of them have a risk for respiratory depression, failure, and related death due to overdosing. So now that you've had a successful nephrectomy surgical procedure, let us discuss the follow-up medications that you may receive. In order to maintain proper pain control for the days post-procedure, you may be prescribed oral opioid pain relievers or acetaminophen-based analgesics. You should maintain the medications as prescribed to properly control your pain. You may also be prescribed a routine course of prophylactic antibiotics in order to prevent a potential bacterial infection of your surgical site. The antibiotics should be taken as prescribed and the entire course should be finished in order to prevent bacterial evolution to MRSA. Probiotic supplements may be taken during your course of antibiotics to maintain a proper gut bacterial biome. In this segment, we have listed medications and herbal supplements that you may be required to stop taking prior to your surgical procedure. We have discussed commonly used sedatives and opioid analgesics that may be used during the procedure, and we have gone over analgesics that may be prescribed to you after the procedure, as well as prophylactic antibiotics. Now that we have covered medications affected during your surgical care, let us move on to lifestyle changes and behavioral modifications post-procedure.
For someone who is a candidate to have a nephrectomy, we use several common tests, such as devices that are able to scan your body, lab work such as a urinalysis and a blood test that is able to see the function of your kidney, and also a biopsy of your kidney. We will get a urine sample from you, and this will be sent to the laboratory here in the hospital, and the technicians will analyze your urine sample and to look to see if there's bacteria present. The test will take some time to actually grow the bacteria, and the medications such as antibiotics that are specific to this type of bacteria can be given to you. If you do not respond to this type of treatment, a nephrectomy may be performed by your doctor. A basic metabolic panel is a blood test that will be able to see the function of your kidneys. This is done by checking several levels that is able to determine the overall function of your kidney's ability to filter waste products made by your body. Devices that are able to scan your kidneys, an ultrasound machine that will check for obstructions of this organ by identifying if you have produced kidney stones or a tumor. A CT scan is also able to gather further details of what type of injury may have occurred within your kidney. Lastly, we will do a tissue biopsy of your kidney. This will be performed to take a small sample of your kidney and will be analyzed to look for cancerous cells. But these results will not come back for a few days. If you have any further questions, let us know, okay? Thank you.
1, go.
After a nephrectomy, you must take measures and make lifestyle changes to protect the remaining kidney and prevent chronic kidney disease. An important lifestyle change includes controlling and preventing high blood pressure because it can damage blood vessels in the kidneys and reduce their ability to work properly. An important change to prevent high blood pressure includes eating a healthy diet by adding more veggies and fruits, less sugars and fats, and limiting your sodium intake. Smoking is also a big contributor to high blood pressure, so patients are highly advised to quit, as smoking can cause the constriction and damage of blood vessels. If you do not have high blood pressure, the doctor will recommend taking blood pressure medications, which will reduce strain on blood vessels and slow and prevent the progression of kidney disease. Another preventative measure is regular testing for signs of kidney damage. This includes albumin testing, which measures the amount of protein in your urine. A GFR will measure how much blood kidneys filter each minute. A GFR less than 90 can mean signs of decreased kidney function. You will also want to monitor and frequently check your blood pressure. Overall, these tests can help ensure proper kidney function. Another lifestyle change includes limiting any high-risk physical activities, such as contact sports, and wearing appropriate protective equipment to prevent injury to the working kidney.